For every HIV infection, there is a story behind it.
Baltimore, Maryland is a city of over 600,000 people, the birthplace of our national anthem, and the epicenter of difficult conversations about disparities based on race when it comes to health, education, and safety. It is also a city where the African American population feels a deep mistrust of the medical community, for reasons both current and historic. The Baltimore City Health Department is working to alleviate some of that mistrust through storytelling. The Health Department launched 2 projects called Baltimore in Conversation and Project Presence, in partnership with community-based organizations. Baltimore in Conversation brings people together informally to share their stories about accessing healthcare and focuses on HIV prevention. Project Presence is a photo project that showcases community members and their stories. Both aim to create a dialogue and bring the community closer.
I remember walking out to this dark stage with just one strobe light.
I'm the first storyteller. I am a physician at Johns Hopkins here in Baltimore, and Michael and others asked me to tell my story.
It was completely amazing. I mean, I think initially I was very nervous. I tend to be an emotional person. I was very concerned that I'd get up there and just start crying and bawling, which I did.
Dr. Sanders is a clinician for HIV-positive patients and took part in the storytelling night hosted by Baltimore in Conversation.
Baltimore in Conversation start with cell meetings of people in 6 or 5, where we just go and just share stories. We're still continuing with that. That's actually our fulcrum. That's our big platform.
In addition to the story circles, Baltimore in Conversation hosts a storytelling night twice a year.
The power behind it is the fact that you're getting real people telling real stories, and they are pretty much being vulnerable in a room of people that they don't even know.
Our theory of change is if we can create conversations, if we can make people talk more about the problems, then maybe we can break the barrier of silence. And if we can break barrier of silence, then we can begin to address all these issues about HIV, about preventions, about treatment.
I don't know, for me, it hits me differently because we talk about HIV and we talk about the black gay community. And for me, HIV doesn't impact me as far as being a black gay man because the first person I knew who was HIV positive was my aunt.
What brought me to the project was just the fact that, it was something different. I wouldn't have probably done it under any other circumstances because, again, of my camera shyness. But everybody on the project made me feel pretty comfortable, and that support system definitely made the difference, and still does.
Cedric and Ali are peer navigators who work with community-based organizations in Baltimore. They are actively involved in the health department's efforts to promote dialogue.
Baltimore, as you know, it's racially, very tense, and that has gone back histories.
The first thing somebody thinks of when I say I'm from Baltimore is, oh, I must have been a drug dealer. I'm 6'3" with long hair, and I dress urban. So people think the worst first, until I open my mouth and rainbows and butterflies come out.
There have been a lot of mistrust in Baltimore about the medical society, and so that was affecting people adhering to their HIV medicine.
And some of that comes from having, historically been experimented on. It's particularly for African Americans, whether or not you think about Tuskegee or, here we wrestle with the HeLa cells and that history associated with that.
One of the obstacles that used to face medical researchers was the difficulty of finding human cells that would keep multiplying in the culture of a petri dish. That problem was solved in 1951 when one doctor took cells from the cervix of a poor African-American woman who was dying of cervical cancer. This line of immortal cells that have contributed so much to science is called HeLa cells, named after Henrietta Lacks, the woman from whom the original cells were taken without her knowledge. The H-E in HeLa is for Henrietta, the L-A is for Lacks. It took 25 years for her family to find out about HeLa cells. Her daughter Deborah wondered, if our mother's cells have done so much for medicine, how come her family can't afford to see doctors?
I think that mistrust has to be addressed head on.
And it was important for me to understand what my son was going through, the changes that he was going through, trying to transition from the boy that I gave birth to the woman he now is. It was hard.
And I was able to say, oh, what if you put yourself in the shoe of the mother? How would you feel if your son that you've been calling, Michael all his life suddenly begins to transition, and now she wants to be Michelle, and all of that, which is empowering for her, but for me as the mother, what's my story? So that's what we are trying to do with Baltimore in Conversation.
But that's my baby, and I'm proud of her. She's working in the did I say it right? LGBTQ community. So I'm learning. I'm trying to learn all this stuff.
And I think the most striking thing for me was not just the fact of telling the story, but there were so many people that came up to me afterwards that were just like, thank you, thank you. One guy I remember, and he has stayed in contact with me because he's involved in the community, but he was like, how can you be my doctor? And that struck me in that I had clearly struck a chord with him to say, I need you to be my doctor to take care of me because I see your passion and your compassion and your commitment. And that was probably the most impactful experience.
HIV is a social justice issue.
Nobody can actually stay adherent to medicine if you don't have a place to live.
Baltimore had 315 new HIV infections in 2014, 88% of which were among those who identified as non-Hispanic Black. 12,600 people are estimated to be living with HIV in Baltimore, and though African Americans only make up 63% of Baltimore's population, they account for 84% of those living with HIV. Baltimore also has higher percentages of people living below poverty compared to the US and Maryland. Homelessness is a concern as well, with nearly 2,800 men, women, and children finding themselves homeless on any given night in Baltimore, according to the Mayor's Office of Human Services.
It's not the fault of public health, but it affects the entire platform of what we want to say, because these same people are fighting the police brutality, they're trying to survive, and we're trying to tell them to use condom or to be on PrEP. No. They have a lot to deal with.
This is the first time that everyone in the city has come together for a common cause to bring awareness to PrEP and HIV care in a way that's been really, really different and really innovative, and the community supports it.
It's important to have that face-to-face interaction so that you can build that trust and build that rapport, and that'll make it easier for you to access care and access those resources that you need. We don't want people to sit and feel that they don't have any resources or they can't trust, the healthcare system, because, there are places where a lot of people don't feel comfortable. We want to make sure that we help you or help them find those places where they can actually access that care.
Human-centered design is about looking at a human in all our approach to public health, to transportation, to whatever it is. Can we go back to the person we really are trying to address? We look at the power structure. We believe that stories should not be single point of view. We have exhibitions. The last one was held at the City Hall, and that was where the power that be, actually are. So they're able to interact with these stories. And we are trying to influence the way they make new laws, new legislations. We're trying to see if they can begin to acknowledge that, the LGBT community in the city, they actually exist, they are present.
These conversations are so key because we often don't talk about how providers communicate and how it may impact someone. Those things can't be unpacked through just like a paper, right? Or through just like data that's shared, but it has to happen sort of on a more personal level.
I really believe that going forward, that's what public health intervention should be about. It should be about going to the roots of the people we're trying to talk to, the human behind this thing.
I do think it's working. It's going to take a while to get it to where we want it, of course, because there's still such a stigma around sexual health and sexual identity that even when it comes to PrEP, people don't want to take PrEP because they feel that if somebody sees the bottle, they're going to automatically be labeled as a whore or labeled as a person that's, having unprotected sex or doing all of these things.
People are educating themselves through their lived experiences, how they survive insurance navigation, how they survive paying for their rent, how they got a new job, and all of that. So those are the stories that people share.
What I love about us is the fact that, we do bus ads or we have the potential to do billboards, but we go out into the actual communities that we're trying to reach.
I think the health department was trying to foster that in the community conversation to really try to address some of these issues, to say, well, we hear you and the key issues that you're saying are important, and hopefully in doing so, you will trust us.
And when they talk with each other, with one another, there seems to be that element of trust coming back, and that element of we can do this, we can change this community.
Everybody came together on that project in a way that was just so supportive that we all are kind of like brothers and sisters now. When before, we probably wouldn't have associated with each other under other circumstances.
There's something about storytelling. Storytelling is so powerful. It's the way the word has come together.
And that's what makes that so successful, is because we're talking to real people about real stories, getting their real stories. We don't edit it, we don't filter it.
So as long as we keep coming together as a community, the sky's the limit.
I think it's going to happen one block at a time, one conversation at a time, like we normally say in our group.
My desire and my hope is to work with young Black MSM after the fact, and meeting them also before the fact, and speaking to them about just how to live and just how to thrive and how to survive, and that you can be gay and you can be Black and you can be HIV positive and you in this country and still live everything.
HIV is going to be cured. We're going to find a cure, and then people are going to run out of what they want to do with HIV. But the stories will never end.